Last week we spoke about PCOS and the diagnosis of PCOS, what it is and how it's defined. In this second part, we are going to talk about the long-term health consequences of PCOS, the influence it has on fertility and pregnancy, and also on the treatment options that we have available for these symptoms. So when we know that patients with PCOS, that many of these patients, in fact about 80%, will be having problems with their weight. They might either be overweight or obese. So what we use is the BMI, that is the length and the mass that we use in the calculations to determine whether patients are classified as either obese or overweight. So according to the World Health Organization, a BMI of more than 25 or equal to 25, you will be classified as overweight. And if it's more than 30, you will be classified as obese. So we know that this is a big problem for a lot of our PCOS patients. So if we talk about the long-term consequences of PCOS, we know that cardiovascular risk factors is part of PCOS. And then women should be aware that the fact that they have been diagnosed with PCOS does make them a risk for these problems. So, and also for increased risk of mortality over the long term. So all women with PCOS, irrespective of their BMI, should be screened for these cardiovascular risk factors. And that includes the lipid profile, which includes the total cholesterol, the LDL, the HDL, and the triglyceride levels. So, and all women with PCOS should be assessed for hypertension when planning pregnancy or even when they are seeking fertility treatment. The reason is that hypertension disorders carries a higher risk for complications in pregnancy, and which some of these can be quite severe. And to start off with, patients should be assessed for high blood pressure, and then also discuss the potential interventions that might reduce their risk. Another factor that's very important is the impaired glucose tolerance that many of these patients might have, and even the risk of developing diabetes. So all patients with PCOS should be assessed for impaired glucose, and then the glycemic index should be assessed. It should be assessed at least once every 3 years, and also then the interventions to reduce these risks. If we talk about glycemic testing, the gold standard is the oral glucose tolerance test, which is a test that patients will do fasting at the lab, and then they will have the glucose monitored. They will be given oral glucose, and then the glucose levels will be, and insulin levels will be measured at 1 hour and 2 hours. And according to this, you'll be classified as either having being normal or have impaired glucose tolerance, or at the worst, having diabetes. So when planning pregnancy and seeking fertility, this should be assessed in all these patients, as we know that patients that get pregnant with glucose levels that are not normal are at an increased risk of complications in pregnancy. So we also know that insulin resistance is part of the pathophysiology of PCOS. Sometimes patients have insulin levels measured, and we know that this is not really accurate and has not been standardized. So, talking then about cardiovascular risk factors and diabetes, why is this important? So, it's important because women's health conditions should actually be assessed and be optimized prior to pregnancy. The reason for this is abnormal weight and having the associated problems going with that does have an influence on your hormonal levels. It might affect the ovulation. Women that are overweight might need more medication to get them to ovulate, and sometimes this medication might also not be effective, and using higher doses of medication is also cost factors involved in that. When you get pregnant, there is a higher risk for complications if your glucose levels are not normal, and this includes a risk for congenital abnormalities in the babies. There's a higher risk for miscarriages. There's a higher risk that once you are pregnant, that these babies might be either too big or too small. We talk about fetal macrosomia or intrauterine growth restriction. And then there's also factors, epigenetic factors. What this means is that your lifestyle and then medical condition might have an impact on the genetic imprint of the offspring, so that these babies might later in their life themselves have problems with diabetes, cardiovascular disease, and so on. Then, if we talk about hypertension and why that's important, hypertension is effectively treated with medication, and antihypertensives, not all antihypertensive medication are safe in pregnancy, so it's important to get the right medication before you get pregnant, ideally, and once you are pregnant, it has to be changed to medication that are considered safe in pregnancy. Patients with uncontrolled hypertension are at an increased risk for pregnancy or hypertensive disorders, which includes miscarriages, abruptio placenta, where the placenta might get detached and you might end up losing the baby, and then also preeclampsia, which is a serious condition in pregnancy that might impact on the mother's health and the babies. Also, patients with hypertension are at an increased risk of premature delivery, where the baby gets delivered before they are actually ready to live comfortably outside and might need to be admitted to intensive care. And then also for the mother it's important, because if they have hypertension that's uncontrolled, they might even get a stroke, or get convulsions, which is important. So coming back to diabetes and glucose control, as far as the babies are concerned, in pregnancy the babies might get very big, which we call fetal macrosomia, or even be very small. There's a higher risk of miscarriages and then even stillbirth in advanced pregnancy. As far as the mothers is concerned, diabetes does influence their health as well. It might impact on their long-term risk for kidney problems, for eye problems, and then also a risk for infections in their pregnancy. Familial history is important in the sense that it's been shown that many of these patients with PCOS in the fathers and their brothers there is a higher risk of also hyperlipidemia, meaning abnormal cholesterol and its problems, hypertensive disorders, and it's important to look into that as well. Quality of life is something that is very important for PCOS patients. We know that PCOS patients often suffer from a poorer quality of life. They suffer from being overweight. They have problems with high androgen levels, which cause unwanted effects, including abnormal hair growth, which is common, and then also acne. Another problem, well, the other thing is that PCOS, we must realize that this is a lifelong condition. A lot of these patients suffer from anxiety and depression. So it has been shown that psychological treatment in these patients are quite effective in a lot of these patients. But patients that do suffer from anxiety and depression needs to be referred to for proper treatment, and this should not be neglected. If depression is not treated, it impacts obviously on their quality of life. It might impact on their relationship with their family, their spouses, and even with child bonding at the long term. That being said, these medications have an influence on how PCOS patients comply or are able to adhere to all the lifestyle interventions that is important. Another important thing with antidepressants is that there is different types of medications, and some of these medications might actually worsen PCOS symptoms, like weight gain, for instance. If we come to lifestyle intervention, that's a very important part of PCOS management. That includes diet advice, which is very important, and then the continued management of things to keep the weight down and under control. So exercise is part of this. It is very important, and there's been many studies on different types of exercise. Is the one better than the other? All the data says that no specific exercise could be shown to be better than the other, but any exercise is definitely helpful and should be recommended for all women with PCOS to improve their metabolic health, to control their overweight, especially central obesity, which impacts on the cardiovascular health, and then also on their lipid profile. We know that there is a health stigma to PCOS, and it is something that many of healthcare workers are sensitized to, because it's always a sensitive issue to talk about weight. But I think it's important that patients understand that this is not to stigmatize obesity, but the influence that it might have on your pregnancy, your health in your pregnancy, and the other long-term risk factors is important. There are medications to treat PCOS symptoms, and these include medication prior to pregnancy then to address acne and abnormal hair growth. This includes medication like metformin and oral contraceptive tablets, of which there is many different types. Some of them work specifically against the abnormal or the high androgen levels to improve these symptoms. And then also the weight is also important because it impacts on this as well. So if you talk about oral contraceptive, one advantage is that might control these patients' cycle regularity, because we know they often have, they mostly have anovulation, which causes them to either skip their cycles or have long irregular cycles. So that will help. That is now for patients that does not want to get pregnant yet, before pregnancy, to manage these symptoms. For patients seeking fertility, contraceptive is not an option, obviously, but we need to address the other issues like weight. Most of the medications that we use, well, the only medication that we can use that address the hyperandrogenetic symptoms is metformin. Unfortunately, this is not a quick fix to sort out the weight problem, but it does improve ovulation, it does improve the abnormal insulin levels, and it's part of treatment for patients in fertility. If we talk about metformin, as we said, this can be used on its own. It can benefit cycle regulation, although we often have to use other medication with that. Metformin alone can be used for patients with BMI less than 25. However, it has not been shown to have to be of major help for these patients. The important patients is patients with a BMI of more than 30, especially if they have other comorbid problems like abnormal lipid profiles, etc. Where metformin is prescribed, it's always a shared decision making. We know that these drugs also have their side effects, of which the gastrointestinal side effects is the most common, and we usually start with a low dose and gradually taper it up to the desired level, which would typically be between 1 gram to 2 grams per day. Also, it's important to know that lifestyle intervention is part of this. Metformin or drugs cannot replace lifestyle intervention. The other problem that we might have with metformin on the long term is that it can lead to low vitamin B levels, and that is also something that needs to be monitored. So in patients that are not pregnant or seeking fertility, then combination of metformin and the oral contraceptive pill can be used, especially for the patients with BMI over 35, to manage their symptoms. When oral contraceptive cannot be tolerated or are not safe for these patients, other options would be then metformin on its own might help for this. The next thing that we can talk about is obesity per se. That is a big problem, and for people to keep their weight down, to lose weight is not easy. It is there is a genetic factor part of this. Obesity is a chronic inflammatory condition that does impact on your long-term health. There are medication available, of which metformin that we just mentioned now. Then to lose weight, metformin on its own hasn't been shown to really make a difference in terms of weight. But there are medications for patients before getting pregnant to help them lose weight, which includes the GLP-1 receptor agonist, which is liraglutide and semaglutide. That is injections that we use. And I think people might be well aware of this. The important thing here is that it's very effective to lower the weight, but you have to adhere to lifestyle intervention in combination with that. It is also not a quick fix or a short-term solution. It has to be used long-term to keep the weight down. And the problem is, if you stop this medication, these patients pick up all the weight again. These medications can also not be used in pregnancy because there's no data of the safetyness of this, and it's important to use contraceptive while on this medication. If we use medication that has anti-androgenic effects, which includes certain progesterones like sapropterin, acetate, and or medications like spironolactone, it's important also to be on contraceptive, because if you do get pregnant and it's a male or a female, a male fetus, it might affect the external genitals of these fetuses due to lack of virilization. So the other thing that we can do to remove hair or for excess hair, there are many different available treatments. The first thing that we said is the pill, and specific pills are used for that. You have to be on it at least for 6 months before it will show proper effect. If it's not effective, then it can be combined with other antiandrogenic medication. Then the other things that one could do is manual removal, which includes waxing, and then laser therapy. That doesn't work for people with light hair. It should be the dark terminal hair that responds best to that, and also mechanical things like IPL. So the last medication or drug that I want to mention is inositol, which is commonly promoted as a dietary supplement for patients with PCOS to help them to ovulate and get pregnant. Now, my inositol is something that we get in human tissue. It plays a role in the secondary messages in cells. It's also part of the structural lipoproteins or lipid structure in tissues. There is a lot been written about it, and it gets promoted to help with ovulation. The problem with this is that there's no good data to really confirm its benefits. It's costly to use. If patients choose to use it, it's harmless, but I think it's just important to know that these over-the-counter medications that get promoted might cost you a lot of money without proven benefit. So this concludes our second session, and our next session will be on where we will discuss PCOS, its effect on fertility, as well as the treatment options.